Hi.
How are you?
Good.
Good. I'm going to be performing your head, ears, eyes, nose, and throat assessment, okay?
Okay.
Okay. The first thing I'm going to start to look at is your skin. Do you mind if I just look at your skin?
Yeah.
Okay, great. Great. I don't notice any hyper or hypopigmentation. Your skin. Great. Okay. Great. Awesome. Do you mind if I look at your nails as well? Okay. I'm just going to press down real quick to check your capillary refill. I'm going to perform that on your toes as well. Great. Okay, your nail beds are appropriately colored with brisk capillary refill. Nail plates are smooth. There's approximately 160 degrees between the plate and the proximal nail folds. The plates are firmly attached and are normal thickness without pallor, cyanosis, clubbing, or ridging, which is a normal assessment. And are normal thickness without pallor, cyanosis, clubbing, or ridging, which is a normal assessment. In relation to your skin, the skin is uniformly toned without any evidence of hypo or hyperpigmentation. The skin is soft, smooth, and is average moisture. The skin is without any lesions, masses, or changes in texture. Okay, Claire, I'm going to inspect your head, okay? I'm just going to get a thorough inspection of your head and your hair, okay?
Sounds good.
Great. Okay, do you feel any tenderness
No.
while I'm pressing? Great, and I notice that your head is round and evenly shaped, and that your hair is not abnormally distributed. The size of your skull is proportionate to your body, round and smooth, with no gross deformities or tenderness. The scalp is appropriately colored without lesions, infestations, or any scaling either. Your hair is brown and is brown color, and it is evenly distributed on the scalp and is well defined with no evidence of hair loss or thinning. And your eyebrows are symmetrical, evenly distributed, and I don't notice any hair thinning on the lower 1/3 of your eye, which would indicate hypothyroidism. Okay?
Okay.
Other things that I'm gonna do while I'm checking your face, I'm gonna feel for your temporal bones and your mandibular bones, okay? Is there any tenderness in there?
No.
Thing I'm gonna also assess is your temporal arteries,
Mm-hmm.
okay? Just gonna feel for them and palpate them. And I can feel them, okay? And they're about a +2, okay? Now start working on your eyes, okay? And I'm gonna assess your eyes, okay?
Okay.
I'm first just gonna get a good look at them, and then I will inspect them with a fundoscope, okay?
Okay.
Okay. So I see that your eyes are brown, gray. I'll just look down here. Great. Can you close your eyes for me? Squeeze them, open them up. Great. Raise your brows for me. Awesome. Okay. What I've noticed is your lids close in unison with blinking to cover the entire eye. The upper lid rests at the superior border of the iris, and the lower margin rests at the inferior border of the iris. The lid margins are appropriately colored without lesion, edema, ptosis, inversion, and the lashes are black colored and evenly distributed and outward pointing. From your conjunctiva, I noticed that while your conjunctiva are appropriately colored, bilaterally without pallor, injection, or lesions. Your sclera are uniformly colored with smooth, moist, and without icterus. There is no scleral nodules nor lesions. Your corneas are smooth, transparent, and shiny with no scarring, lesions, opacities, or icterus. Your iris is brown in color, round, regular, and have clear detail and uniform in pigmentation. The pupils constricted to 2 millimeters, round, regular, and equal bilaterally. They respond quickly and equally direct and consensual light. Your eyes with the fundoscope, okay? Okay. Okay, Claire, now time for your fundoscopic exam. Okay, I'm just gonna look in here. Okay, and then I'm gonna look in here. Okay. Okay, Claire, so from the results from your fundoscopic exam that we found, I wanted to let you know that the red reflex is present, the lens and vitreous are clear with no opacities or floaters. The retina is appropriately colored, smooth, shiny with no hemorrhages, lesions, hard or soft exudates. The arterioles are bright red and curving. The veins are darker, red, and larger, with no nicking or hemorrhaging. The optic disc is yellow, pink with clear, sharp margins, and the physiological cup is appropriately sized. Depth color is approximately 1/3 of the size of the optic disc. Okay? Movements that I want you to follow with me, okay?
Okay.
So I want you to follow my finger, okay? And we're gonna try to test your extraocular movements here. So I want you to just follow my finger, okay? Great. 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 I didn't notice any abnormalities in your extraocular movements, okay?
Okay.
I'm gonna test another thing for accommodation and for nystagmuses, okay? So just please follow my eye, okay? Great. Okay. Great. Thank you.
Yeah.
So, your extraocular movements are intact with no nystagmus or strabismus. Let's try doing your visual acuity now, okay?
Okay.
And we'll test for your visual fields as well. But also from that test, we know that your positive accommodation response is noted, which is good, okay? I'm gonna bring you over. Claire, you are appropriately 20 feet away from our Snellen chart on the board over here. I want you to just go ahead and cover up your left eye for me, and I want you to read this line right here of our Snellen chart.
P, E, E, P.
Great. Can you do it for the other eye now?
P, E, E, P.
Great. And now do it without.
P, E, E, P.
Great. Results of your acuity tester, and I just want to do one more test, okay? So I want you to tell me here, I'm going to come behind you, and I want you to tell me when you stop seeing my fingers.
No.
Okay. Okay, Claire, great. So from the results from those tests that I did, we know that your eyes are 20/20 OD, 20/20 OS, and 20/20 OU. And you have normal visual acuity in both of your eyes, okay? Okay, Claire, I'm gonna inspect your ears now, okay?
Okay.
I'm just gonna use this to help me kind of just get a good look. And we will use this as our kind of otoscope for right now because I don't have one with me, okay?
Okay.
I'm just gonna basically, for you, gonna be pulling your ears back and up since you're older than the age of 7, and for kids under the age of 7, it would be back and down, okay? I'm just gonna notice the shape and the size. Okay, great. I'm gonna come over here to this other side, okay? Great. Okay, I'm just gonna assess also around here for just any tenderness. Great. Any pain on there when I look in there? Okay, and you have very minimal cerumen. No. What I want you to do for me is I want you to perform a couple of tests for me, okay?
Okay.
I'm gonna perform first off starting the whisper test where I'm gonna whisper 2 feet away from one ear, and I want you to read and say to me what you heard me say, okay?
Okay. Sunday. Tuesday.
Great. You did really good with that, okay? I'm gonna now perform a Weber and Rhine test, okay? I don't have the correct instrument with me now, but we'll fake and pretend that this is the correct instrument, okay? I'm gonna tap the Weber. You tell me when you don't hear it anymore, okay?
No.
Great. Okay, great job. I'm gonna test now for the Rhine test, okay? I'm gonna tap it and I'm gonna put it over here on your temporal bone, your mandibular bone, okay? And tell me when you don't hear it anymore, or when you do hear it.
No.
Great. I'll just try one more time on the other ear. Great, okay. Thank you. Okay, Claire, so I have your results. Your auricles are appropriately colored, warm, dry, smooth, and they are at the level of symmetry, that they're appropriate level of symmetry. The superior aspect of the ear is level with the higher, higher than or outer than the canulus of the eye. Their size is proportionate with no lesions, deformities, masses, or discharge. Your mastoids are not tender bilaterally. I notice that your ear canals are appropriately colored with scant amount of hair present, and a scant amount of cerumen is also noted with no discharges or lesions or foreign bodies. The tympanic membrane is pearly gray and shiny, and the incus and malleus are clearly defined. The cone of light is at 5 o'clock in the right ear and at 7 o'clock in the left ear in both of your ears. There is no erythema perforations that I noted. Your auditory acuity is intact, as I whispered from 2 feet away on AD, AS, and AU. I performed the Weber test, and you were able to lateralize the sound, and I performed the rhyme test, okay? And now inspect your nose, okay? I'm gonna inspect your nose, mouth, and just all of the parts, kind of.
Okay.
So I'm gonna be feeling here. Let me know if you feel any tenderness, okay? I'm gonna just palpate the outside and the external part, okay? Okay, now I'm gonna take my visionary tool, which is a 3-in-1, and I'm gonna look in your nose. Great, okay, great, fantastic. And I'm gonna also look at your turbinates in there. Okay, you don't see any redness or erythema. Now, do you mind if you open your mouth for me?
Yeah.
Okay, I'm gonna flash my light. Which is an amazing tool. It has all the things in it. Great. Wow, great. Can you say ah for me? Great. I have a question. Can you do me a frowny face and a smiley face? Great. Thank you. Tell me what smell this is?
Lavender.
Great. So, I noticed that your skeleton is straight and midline with no deformities or deviations. Will you please blow out of one nose and then blow out the other one? Great. I notice that your airway is patent and there's nothing occluding it. Nares are patent and your smell is intact. Great job. So your smell is intact. There's light hair presence in your nose with bilaterally no discharge, erythema, edema, or lesions, okay? Your septum is midline intact with no deformities, ulcerations, or erythema. Your mucus is pink, moist, with no ulcerations and erythema. I notice that your turbinates, lower and middle turbinates, are darker in color than the mucus with no edema, discharge, or erythema. And your sinuses, frontal, maxillary sinuses are non-tender bilaterally with no fullness or erythema, which we felt on your face, okay? Great. Your lips are appropriately colored and moist, no lesions, ulcerations, nodules, or cracking. Your tongue is straight and midline. And your tongue is appropriately colored, rough with light papillae and no lesions, coating, or asymmetry. Your sublingual region, your frenulum is intact. Your blood vessels are visible, although salivary glands are not visible. There's no lesions, ulcerations, or varicosities, okay? Your mucus is appropriately colored, smooth and moist with no lesions. Openings of the parotids and visual bilaterally with no edema. Your hard and soft palate are continuously smooth with no lesions and edema either. Hey Claire, so now I'm going to go ahead and I'm going to inspect your neck, okay? I'm going to inspect it and then I'm going to go ahead and palpate it and I'm going to feel for some of those nodes, okay? And then I'll feel for your trachea and your thyroid, okay? So just let me know if you feel uncomfortable at all, okay?
Okay.
So I'm just going to start off by feeling the size and the shape and the symmetry. Great. Looks good and normal. Okay, now I'm going to start to feel around. I want you to just kind of move your neck around and show me some of that range of motion. And then I'm going to start feeling for your lymph nodes, okay? I'm going to look at your pre-auricular lymph nodes, your post-auricular lymph nodes. I'm going to feel for your occipital lymph nodes, your tonsillar lymph nodes. I'm going to look for your feel for your submental lymph nodes, your anterior cervical, and your posterior cervical, okay? And then I'm gonna check lastly for your supraclavicular nodes, okay? And those all don't feel palpable or tender. Did you feel any tenderness?
Nope.
Great. A couple other things that I'm gonna feel for now is I'm gonna start to look at your trachea, and I'm gonna look for it and midline, okay? It doesn't deviate from the midline, it looks straight. Your trachea is straight and midline without masses or deviations. Okay, and I'm gonna feel a couple more things. I'm gonna feel for your carotid pulses, and then I'll start feeling for your thyroid, okay?
Okay.
So what I'm gonna do is place one of my fingers on your carotid artery, okay? And then I'll go over to the other side and try that, okay? Okay, good, good. Your carotid artery on the left side is a 2+. Great, and your carotid artery on the right side is 2+, okay? I'm gonna now feel for your thyroid, so what I want you to do is lean forward a little bit, flex your neck a little bit, and I want you to go ahead, and I want you to swallow. Great, fantastic. So, your isthmus is palpable below the level of the cricoid cartilage. Your lobes are non-palpable without masses, thyromegaly, or any tenderness. Bilaterally, you have 2+ carotid arteries with regular rhythm and no bruits. And thank you, Claire, for coming to my clinic today.
Thank you.